once again, welcome back to Chit Chat Uganda, where we say the unsaid. Thank you so much for subscribing. Thank you so much for sharing, liking, and commenting. Thank you, thank you, thank you. Today, we are going to look at the critical signs that any pregnant woman should watch out for, even those signs in the newborn babies. According to the Ministry of Health, the current maternal mortality ratio in Uganda is at 189 maternal deaths per 100,000 live births. And the infant mortality rate is at 36 deaths per 1,000 live births. What causes this ratio? Why are mothers dying during pregnancy? And why are the newborn babies dying when they have been given birth? Today we have an expert with us who is going to take us through those critical signs that any mother, any woman that is preparing to give birth should look out for before and even after giving birth to that child. You have to look out for those signs in the newborn babies. Our guest today is an expert in that field. He is a gynecologist. He is a doctor. He works with Mercy Medical Center and with Nsambia Hospital. Dr. Lumara, you're welcome to the show.
Thank you very much, Lillian and Edith, for inviting me here on Chit Chat Uganda. I'm actually your fan. I follow you on YouTube and I'm a subscriber there.
Wow, thank you so much. Dr. tusanyusa okulaba. Thank you so much for coming. So olunaku olwaleero Dr. abalabi baffe ddala abakyala b'embuto beetaaga okumanya what are these critical signs ze banditunuulidde ne bagamba bannange oba ndi buzibu oba nkyali bulungi. What are these critical signs omukyala w'embuto ali eyo ze yandiyagadde okumanya? Yeah.
Okay, thank you, Edith. So as earlier on, Lillian introduced that our maternal mortality ratio is now at 189. Actually, that is a great improvement from what we've had for the last 6 years, because initially it has been at 336. And as she said, this is a recent statistics as of Ministry of Health released 2022. So it's recent. And I would say that's a great improvement because it seems we are moving towards the Sustainable Development Goal number 3, where WHO, the target is that at least world over, we have less than 70 deaths per 100,000. So I think we are doing well, we are moving there. And when we talk of maternal mortality, we are talking of a mother, a woman dying. She dies when either she's pregnant or during the time of delivery or even after delivery, up to about 6 weeks after she has delivered. So even during that period, any complications, maybe she sustained during delivery, she dies, we still consider that as a maternal mortality. And infant mortality, that one we look at a baby who has been born, but an infant is a child who is below 1 year. So below 1 year, but under that we have what we call a neonate. So a neonate is the one who is below 1 month. Yes, so under the causes of infant mortality, we have those that cause the neonatal mortality. And I think today we shall basically be looking at the danger signs in this neonate, the one who is born and below 1 month. Yeah, so now to start with the pregnant women. You see, pregnancy, for us, we normally group it into 3. We have the first part of it, and those are the first 3 months we go up to 9 months. That's what
that is what they call the first trimester.
Exactly. I'm glad that you know
And
those
we are
terms.
mothers.
Okay. So that is the first trimester, first 3 months. And then we have the middle part, or the second trimester, the next 3 months. And then we have the last part, which is the third trimester. And in each of those, there could be specific danger signs. However, some of them can cut across all through. And when a mother sees these danger signs, then they should suspect something. Maybe also to mention is that that first and the last trimester, or the first and the third part, they're very critical, because when we look at the first part, that is where the baby is just beginning to form in the mother's womb, and that is very delicate. If a mother does anything that can harm the baby, then this baby will grow with some problems or complications. And now the middle part, still can have danger signs, and problems can happen there, but at least there the mother stabilizes a bit. And then we come to the last one. That one is also very critical, because all the way for the first 6 months, the baby has been formed, the baby is growing, and now we are almost preparing to deliver. Very many complications can happen there. So this last part, we also need to take care of it very, very carefully. Yes. Now, to start with the first trimester, or the first part of the pregnancy, a mother, and that's why we encourage women to always come for antenatal care as early as possible.
Doctor, yes, you encourage mothers to come as early as possible. But I'll give an example with myself. Now I start antenatal when I'm almost ending the second trimester.
Oh, yeah, and you see now, that is a problem. And you know what happens? Normally, those ones who are first-time mothers, they will tell them they will come early. But after you've delivered like 1 or 2, then you begin saying, but I know what they do in those first few months. Those ones I don't need to. But you see, even as you deliver more children, actually there are some risks which come.
True.
So you actually even need to come the earlier. Okay? So we encourage mothers, the moment you know that you are pregnant, you come and we start antenatal. Because during antenatal, we are going to educate you about these danger signs. We're going to try to see that the baby is growing very well and is being formed very well. So in those first 3 months, we can have danger signs. One of them is vomiting, nausea and vomiting. This one is, we call it physiological in our language, the medical language. Physiological, when, because of the woman is pregnant, the hormones, they always have that nausea. They feel they want to vomit, or sometimes they vomit. However, it can become too much. It can become too much. What we call hyperemesis gravidarum. That's the term, the medical term that we give it. So it is too much now that, a mother is almost vomiting like 8, 10 or more times in a day. And the woman is unable almost to take in anything. Now there it becomes dangerous. If she has like vomiting twice a day, she has nausea 3 times a day, that's okay. And she's able to take in something. Because if she vomits like that and she's not eating, that means she's losing water, she's getting dehydrated, and before you know it, after a few days, she's also losing weight. Okay?
So, doctor, vomiting is normal. It's okay.
Yes.
If it doesn't go beyond.
Exactly.
One is supposed to, because we thought that vomiting has no problem. It has no limit. You can vomit and vomit and vomit, but provided you're out of that first trimester, the vomiting has to stop.
Okay.
So when it goes beyond, it becomes an issue.
Exactly.
Okay.
And that's why I started with it, because you will have a friend that will tell you she has ever delivered. That one is okay, but you're keeping on vomiting. So there is that which is okay, as you've said, but it can go beyond. Okay. So the woman needs to watch out for that. And the moment that is happening, we encourage them to run to the hospital and see a doctor. So that can happen in the first trimester. Another danger sign we can have is the woman can begin bleeding. It can start as small drops, but also increase. We encourage them to run to hospital because two things could be happening. One, she could be having what we call a threatening miscarriage. Okay? The pregnancy wants to come out. That's a what? A miscarriage. Or she can even lose a pregnancy during that first part of the pregnancy. But also, that bleeding could mean that the pregnancy did not go into the right place. Yes, what we call ectopic pregnancy, because the pregnancy is supposed to go into the womb, but the baby could start growing from the tubes of the mother. Okay, because the baby is supposed to come from the tubes and then go to the womb. So that can be a danger sign. The moment she sees that, we encourage her to run to a hospital where she will need a proper assessment.
So, doctor, you've talked about bleeding. Doesn't it come with some pain? Me to notice until I have to run, because most of the time, yes, kale is okulaba drop. You know, women, tulina input too. You continue, olaba guna yikira dala. Doesn't it come with some pain, like that severe pain, which is so that it helps me come, running to protect myself?
Yes, thank you very much. Actually, what you've said is right. Yeah, the reason I said the bleeding may come because sometimes it may not come with the pain. And when it just comes with the pain, especially what I talked about, if it's the pregnancy wants to come out, what we call it is threatening to come out. And whereby if we intervene early, if we come in early, we could do something, But sometimes it can come with the pain, pain on the mother's stomach. And the pain may be so severe, may be too much. And in most cases, if that pain is too much, it is the other thing which I talked about, that the pregnancy may not be in the right place. Okay? It may not be in the right place. It happens. And sometimes the woman could have lost this pregnancy and even developed infections, which now, goes through down there and they go up, and then she even develops this too much pain. So another danger sign, now, this one can cut across all through the trimesters. The common things, a woman getting a fever, okay? We shouldn't take it for granted. The reason we are talking about this as danger signs is because, a woman who is pregnant is two in one, the mother and the baby inside. Because normally, somebody gets a fever, when you're not pregnant, you can run to a clinic and pick something, to calm down the fever. But the reason we say this is dangerous, you have to run to hospital, is because it will not only harm you, but also harm the growing baby. So just getting a fever or even a headache, signs which could be signs of a malaria or a typhoid, because when you are pregnant, it doesn't mean that those other diseases have stopped. They still continue. So all those signs that we can normally get when we are not pregnant, we still need to look out for them. The difference here we say is that a mother should not go to a clinic. A mother should run to a hospital.
Doctor, you've talked of the fever and a mother going to a clinic. I know of people who get the fever and they're like, this is the normal pregnancy fever. Let me swallow my fancy that, because I know still if I go to the hospital, that is what they're going to give me. And some end up going to clinics where they're given I think, I don't know whether it is true, where they are given medicine or medication that does not work in line with the health condition they are in. And some end up getting miscarriages.
Yes.
Is there any recommendable medication that a pregnant woman who gets fever or malaria, let's say in the first trimester or the second trimester, that woman should take or should not take?
Okay. Thank you very much, Lillian, for that. That is very true. Because as we said, especially the first trimester, the baby is just beginning to form.
Very delicate.
Very delicate. You know, you make one mistake and then you have a complication on this baby. If at all is able to grow, you know, up to the last weeks, and then you deliver, they will have complications which you cannot reverse. So there are many medications that a pregnant woman stops. Okay? There are very many. And those ones, sometimes you only know it if you go to a hospital. In a clinic, they will say, okay, oh, you have a fever, then you get this medicine. I'm not saying they don't know, but you know, sometimes they'll say, you get this medicine and swallow, you will be fine. But not knowing that medicine is instead going to harm the what? The baby. So that's why I encourage, you know, if you have a fever, it can be too much. You know, we discourage self-medication. But and maybe you can have a Panadol, and you know, you feel the headache is too much, the fever is too much. Okay, let me swallow a Panadol, and then run to what? To hospital. That can be like a first aid, but not to keep home and say, let me take my Panadol and I see. Okay? Yes.
Okay.
So the other danger sign we can have during that first part of the pregnancy is the woman is, you know, urinating so frequently. You know, urinating so frequently. Maybe she's having some burning down there, or she even gets some abnormal discharge. Abnormal meaning it's not the normal. You know, women can know those discharges, but the discharge is there. Maybe it's like greenish. It can be, you know, creamy or like, you know, cuddy, and sometimes it has a foul smell. Foul smell means the smell is not good, and a woman can know that this discharge is not really normal. So that means the woman may have an infection. Okay, and every time we talk of this infection, you're talking of harm to the woman and also harm to the baby. And this infection can even cause a what? A miscarriage as it persists there. So once you see that you are going, you know, urinating so frequently, you feel the urine is as if it's burning you, those signs which at least many of us know of UTI. You know, at least the term UTI, you know, almost everybody knows.
The term UTI itself speaks a lot.
Exactly. You know, I have a UTI. So you need to run to the hospital. They do tests, they find the infection there and treat it. Because you go to a clinic, as I said, they say, I think you have a UTI. You get this medicine, which actually treats a UTI, but not for a pregnant woman. Yes. So these are some of the signs that we can look out for a woman in that first part of the pregnancy. So when we move to the second part, what you said is the second trimester, some of these signs can continue during that period. And because all these signs, as I said, the bleeding, you have pain on your stomach, that could be a sign that maybe, you know, the pregnancy wants to come out, or sometimes it has already come out. Okay? But now, for a pregnancy being in, as I said, not in the right position, that normally happens in that first part. So every time we see bleeding in this second part, normally we are thinking of a miscarriage. Either the pregnancy wants to come out, or even sometimes it has already come out. We see women who come, you try to check them, you do a scan, you examine them, and unfortunately the pregnancy has come out.
In the second trimester?
Yes.
Actually, me, I call that second trimester, the chilling trimester, whereby I can eat everything. I'm very normal.
So it's a little bit stable. But that doesn't mean that she cannot get problems. She cannot get complications. And all these danger signs we've talked about, they can still happen. actually even what we talked about, that excessive vomiting and feeling you want to vomit, for some women it can continue. It does. So yeah, although we expect that it should stop around the first 3 months, 4 months, it should really, calm down. But it can continue. And so any of those signs that we mentioned, if they do happen in the second trimester, still a woman has to run to the hospital. Now, in the second trimester, other complications now continue coming, which were not so much there in the first trimester. For example, blood pressure, it can rise. Doesn't mean it can't rise there initially, but when we find it in the first trimester, especially, we say that this blood pressure, most probably it was there, but a woman can be very normal, has a very good blood pressure, but around the 5th month, okay, 5th month, what we say around 20 weeks, then the blood pressure goes up. This blood pressure also can be so dangerous in that it can even cause a woman to start what we call convulsions, to fit when they're at home. That's why, every time they come to the clinic, antenatal clinic, we have to take the blood pressure. How is it moving? So because to the second trimester, towards the end there, the blood pressure can do what? It can rise. And now we have to take measures, to calm it down. Now, because in the first trimester, it's not so easy or possible for a woman to begin feeling the baby moving. Okay? Normally it doesn't happen. So around the second trimester, towards the end there, at least a woman should start feeling the baby moving. Okay? Moving. And we educate them, you can sense the baby moving, moves, I feel the baby plays, what? And now all of a sudden begins feeling the baby is not moving very well. What we call reduced fetal movements. Fetus is the baby who is growing inside. They have reduced. It is a danger sign because anything could be happening to that baby that is making that baby not happy inside. Maybe.
How many times is a baby supposed to move in that trimester? For you to as a mother, to know my baby is normal, my baby is moving. How many times is the baby supposed to move?
Okay. Now, it may not be so easy for us to tell the number of times, okay? But at least the woman is used to those. They are regular, exactly. Because we say a baby can actually sleep for about 40 minutes when they are inside, okay? They sleep. And during that time when they are sleeping, you will not feel the baby kicking or moving. But after those 40 minutes, the baby should come back, wake up, and start playing. Okay?
And start looking for mommy.
Exactly, inside. So if you have like 2 hours, 3 hours, 4 hours, you're not feeling anything, the baby cannot be sleeping all that time. Then that means something could be going wrong. And the good thing, God is so great. The good thing with babies, they are not like us, the people who are walking, the human beings who are walking around, that, you can be walking there and all of a sudden you drop down and you're dead. Somebody says, he collapsed there and he died instantly. Babies don't behave like that. Babies, they start showing signs earlier. It's not playing very well, not moving very well, then that means something is going wrong. Okay? And that means you need to see a doctor and try to check what could be the cause, the problem. Yes. So those things happen in the second trimester. Together with the others, things like the fevers, the UTIs, those infections, they can still do what? Continue in the
up to the third trimester.
Yes, up to actually to the third trimester.
Even vomiting.
Now vomiting, it can continue because what causes the vomiting? It's the woman's hormones. But they keep on, as she stabilizes, it reduces. But you find a few who actually vomit up to the time almost they're about to deliver. But those are a few. Those are a few. And those variations, they can happen because of other factors now added in. Some factors, genetics and what. Okay. Now, When we move to the third trimester, still now there are danger signs we have to look out for.
Oh, Doctor, a little before the third trimester. Doctor, you talked about pressure.
Yes.
Nze nga nze sikinnyonnyose bulungi eyandibadde eyo naye yeetaaga okinnyonnyoka. Yes, you say there is that high blood pressure. You said it's about pregnancy. Naye nze nga nze nandibadde neetaaga okumanya biki byenyinza okwewala oba ali eyo biki byayinza okwewala not for her blood pressure to rise oba sirya kino oba nkole ku physicals ki ekireetera ddala that high blood pressure in a pregnant woman.
Okay, thank you very much. Yes, now that high blood pressure, which the most dangerous part, which I was talking about, what we call preeclampsia. We actually say that the cause is not so clearly known. However, there are things, we talk about. We when a cause for something, for us, this side of the medical, when it's not clear, we talk of theories. That maybe there's this theory. Maybe it could be this. Maybe it could be this. So when the baby is growing, there's what develops what we call a placenta. Placenta is where the baby gets everything. The wastes come out as the baby gets the nutrition to help. So it also has to be inside the woman's womb to attach there and grow there. But sometimes when it is attaching there and growing, it does not attach in a normal way. Okay? And then we say there are some substances that can be released inside the woman's body system. That now those things can affect the blood vessels, the blood vessels which carry blood, and then they can cause them to narrow, become smaller. And because blood has been moving in a pipe, the blood vessel which is wide, when it becomes smaller, that means the pressure with which it has to go through, it will have to increase. Okay, but that was caused because there is a baby and what we call the placenta there. Okay, now still about that pressure which can go up. Sometimes we say there are what we can call risk factors, things, because you are asking me kiki nninza okukola okwewala. Okay, some people you may not do much, you as an individual, but when you come to the antenatal clinic early and we spot out that Edith may be having these risks, then we can try to take some measures. Okay, because if a woman has ever delivered and has ever had that pressure before, then there are high chances that even in the other pregnancies she can have the pressure. Okay, if in the family there are people, or you have your sisters and what they delivered, they are also having those pressures. Even your mother, she can say, I delivered you, but I suffered with pressure. Then you're at risk now. Okay, and we begin detecting those things. If a woman has any other conditions, what we call comorbidities, for example, she has high blood sugar even before she conceives, then she stands risks, of getting that pressure. And if you get twins, if you have twins, then those are also risks. So there are quite a number of risks, that we can talk of. But so the good thing with coming early for antenatal, we ask you, if it's your first time, we ask you so many questions. We have to detect as a woman comes for antenatal, we screen her and we say her, this woman is having these risks, and therefore she's likely to suffer from these complications, including the pressure going up at one point. And so we have to be watching out for those things. Yes. And actually, if, for example, a woman has ever had that condition of high blood pressure, which, because they are like of two types, of different types, almost like 4, but we shall not go into the details. But this one, which is what we call preeclampsia, which comes, it is more dangerous than these others. If a woman has ever had it in a previous pregnancy, and now she comes early enough in the first part of the pregnancy, there are some medications we can give her as she gets into the second trimester, which can help her to avoid it in this other in this other pregnancy. Yes.
Okay.
Yes.
Then the risks in the third trimester.
Yes. And now when we move to the third trimester, so as I said, there are those danger signs which cut across. I said fever, headache, those things, which can be because of a malaria, because of an infection. But now, especially from the end of the second trimester, you enter the third trimester. If a woman begins getting a headache, this headache is persistent, it is there, it is so much, okay? Now it can be coupled with she feels she wants to vomit, or even she vomits, okay? And now she has pain in her tummy, especially on the upper part, okay? And then she gets swelling of the body or the legs. We know that is normal, they can swell, but these things are coming together. She's having this headache, the legs are swollen, she's, her sight is a little bit disturbed. She's seeing things that are not so clear, what we call visual blurring. Then those could be very dangerous signs for that blood pressure which I've been talking about, which we call preeclampsia. And I've tried to dwell on it because it's very dangerous. It can go beyond, and the woman starts to fit, to convulse, and that can just kill the baby within a short period of time, and also kill the mother.
Can you imagine?
Yes.
No, that is normal. Just go home, put your feet up, put them in a basin of water, tell someone to help you massage them. Kumbe it is pressure.
Yes, it can be pressure. Much as, if they started, especially in the second trimester, they started swelling, but we've been monitoring your pressure and it is okay. So we can counsel you and we say it's not so worrying. But still, this pressure can come at any one time, as we've said, from the 5th month, where you are in the second trimester, now you enter the third trimester. So it is something to watch out for. A woman could be having ulcers. She has had her ulcers. But now, okay, for the past few days, she doesn't have any pain up there. And now she gets the pain and says, these are ulcers. Maybe she even has some tablets there to swallow. And then she swallows and then continues. Then she gets a headache. Maybe I didn't sleep well. Take Panadol, something like that. Yet, all these signs are now telling her, now things are going wrong. What you call ulcers is different. It's because of the pressure that has caused it. So, now when we enter the third trimester, this one, you've moved all this journey, 6 months now. You've entered the 7th month and you're almost ending the journey. We need to be very careful because you don't want to walk this journey all this far and then everything just, gets, ends just like that without a baby. So that's why actually we tell women to come more times for antenatal during this trimester because so what we've talked about are those signs which can be because of pressure. They can, like a headache, as I said, it can be because of any other illness, a malaria and the rest. But now also, the woman can start bleeding.
At the last?
Yes, during this last trimester. Yes, although now, this one, it will be different. Because the other time we are talking of a miscarriage. Because the baby is not yet grown to where we think maturity, But now the baby has grown. And this baby can actually survive if delivered. Okay, so that thing we talked of, the placenta, the what normally they say in our local language, that feeds the baby. It can begin detaching. Okay, it detaches, going off the womb before time for any reasons. Okay, it can be, and then you see that bleeding. And of course, if it goes off completely, the baby has nothing for feeding and will die. So meaning when you see that bleeding, whether small or much, you still need to run to the hospital. And that means the doctor will judge, what is the cause? What has caused this bleeding? Because even that, what we call that placenta, it can come down, it can grow from down where the baby is supposed to pass. That's where it is. So as, continue growing, the womb expands, then also, detaches a bit, and then you see the bleeding. So that bleeding, you should never take it for granted. A woman should never take that bleeding for granted. However, the waters also can break where the baby is growing in the womb. And then suddenly, the woman will see water coming from down and then maybe flowing over the thighs and then even down.
I thought that happens when you're almost due.
Exactly. We expect it in the normal situations to happen when it is you are almost due. Or you are even in labor, you're going to deliver. But now it can happen in these situations for different causes, even an infection. That's why we don't take those things for granted. An infection, and then the water breaks. But the water breaks, the baby is just 8 months. Okay? And this is the water which is supporting the baby to grow, even helping the baby to grow the lungs and everything. So a moment that water breaks and you see it has poured, you have to run to the hospital. And the doctor has to do some tests, has to check you and judge. It has poured. It could pour, but pour a little, not the whole of it. Okay? Then do a scan, check how much has remained. Is it enough for the baby to survive? And in most cases, such women, they will need admission in the hospital. And they monitor them very closely. Is this water continuing? Because if it pours the whole of it, then that means there's no way the baby is going to survive. And because this baby has grown a little bit, then we can choose to help you deliver this baby. And then the baby taken to the nursery where they can grow.
Thank you so much, Doctor. Indeed, the information you're giving us, now I'm just looking at myself, what I've been doing. To all our viewers out there, going to the hospital for antenatal should not start in the second trimester. You should start early so that you can watch out for these signs. Honestly, I thought swollen legs is something normal. Just put the legs in the water or on a raised stool, everything will be okay. Let's not take things for granted. Let's take care of ourselves and the babies we are carrying. Because in the Bible, God tells us God is going to bless the fruits of our womb. And there's no way He can bless those fruits without us first taking good care of them before they come out. So, Doctor, thank you so much for that information.
You're welcome.
Kindly take us through the risks. How am I going to look after my fruit after giving birth? What are those signs am I supposed to look out for?
Okay.
At that, you said the neonatal stage.
Period. Yes.
Wow.
Very good. Yes. Thank you very much, Lillian. And as you can see that we've tried to dwell more on the woman who is pregnant, because once you have a health pregnant woman or a healthy mother, then you will most probably have a healthy baby. Okay, but if things go wrong during pregnancy, then things or complications are going also to go wrong when the baby is born. So once the baby is born, and this one, let me also state it, we encourage all women to deliver from hospitals. We encourage them, although still we have those, who go to Nalongo somewhere and they deliver there. A woman can get complications from there when she's delivering. And unfortunately, they may not be able to handle them. And the same to the baby who is born. So once this baby has been born, we expect the baby should come out, and the first thing the baby to do is to do what? To cry. Okay? That one is, we expect, that's a normal baby. Exactly. They're supposed to cry. But you may deliver a baby and does not cry immediately. Okay? That's why if you deliver from a hospital by a health worker, every baby who is born, we score them, we give them marks, and the maximum is 10. So yes, so if you ever got a chance to look at those charts of ours, the files, every baby who is born, we say this one has scored 9 out of 10. This one has scored 10 out of 10.
Okay.
Or now this one has scored less. And we look at different things. Number one, as I said, if that baby comes out and cries, most probably many things on that baby, they are okay. Because we have to look at the color, the skin color of the baby. Ideally, it should be pink. But you can deliver a baby, give birth to a baby who is bluish, okay? Has some blue coloration, maybe around the lips, around the tongue, okay? And then this baby also is not crying. So all these I'm talking over now danger signs.
Okay.
The color of the baby is not the normal one we expect. The baby has not cried immediately after delivery. You try to shake the baby, they could be there breathing, but they are breathing very fast, okay? More than the normal. Now, this one, the health worker is assessing immediately after delivery, okay? When you've given birth. It's not moving very well. You try to touch the hand, it's just falling. Because when a baby is born and his health is okay, try to pull the hand, you know, you feel there's some strength, energy, even in the legs. But the baby, the hand is just falling there, okay? They try to give the baby the breast to suckle, cannot. Because this is an inborn thing. It's a reflex. You wonder, the baby, once the baby is born, put the breast, the baby will suckle, okay? Even if you just put a finger, they will suckle because it is inborn. God just put it there in them. So you see all these things and the baby is unable to do them. Then these are danger signs, okay? Sometimes the baby may develop a very high fever. You put a thermometer and you see the temperatures are there, 39.
After birth?
Yes, after birth. A few hours, normally, a few hours after birth, you know, and you check the temperature, and the temperature is very high. But also the very low temperature is not good. Okay? What we call hypothermia is not good for the baby. The baby should be kept warm. Now, many of these danger signs, if the baby is born like this, the cause is not any other thing that the baby has found problems on earth. No. The problems happened when the baby was inside. Okay? Either during the pregnancy, towards the end, because they can develop complications inside. Complications even on the heart, in the lungs, whereby if they are born, because inside the baby is not using the lungs to breathe, but when they are born, they are going to use the lungs. So if they developed complications around there, the lungs did not grow very well, or they are born, they are preterm, okay? Prematures. That means the lungs didn't grow very well. Then they will not breathe very well when they come. They can sometimes just give a cry at once, and then the baby stops sort of, you know. So the health worker is watching out for the things. But even when they have given you the baby, because normally we shall give the mother the baby when we think the baby is fine, okay? But even when they were delivered, they scored marks, they got 9 out of 10, 8 out of 10. Problems can happen, you know, especially those first 3 days, you know, when the baby is born. They are prone to problems there. And in most cases, these problems also could have been around when the child, you know, is born, because when the child is, you know, the mother is in labor, reaches the time is going to push the baby, they can get complications there. Trying to push, the baby is not coming out, it's taking so many hours, and the baby is getting tired because they want to come out. And that's why, you know, you see the baby is born and then they are tired. We say they are tired and then we have to put them on oxygen. But even when the mother has the baby, has to continue watching out for these danger signs. The baby gets a high temperature. They can even just feel. Those who can be able to get a thermometer, you teach them. When you see this temperature is very high. When you see temperature below this, you know, 35 degrees, it is below, it is low. The baby should not have that what? That temperature. Now, a baby is not breastfeeding, that is a danger sign. Ideally, a baby should be breastfeeding. Okay? Let alone some women who say, I don't want to breastfeed. Now, that's not a good thing. You know, should put the baby on the breast because it has so many benefits.
Yes,
Okay?
and Dr. Ntwalo, like omwana obutayonka bakirina nnyo nti oba akanywanto kanene oba tannaba kugira, is it a must nti ye waagwirawo bw'ati oba nene ennywanto oba ki ayina ttandikirawo?
Exactly. Except, yes, and that's why during antenatal, towards delivery, we do some of those assessments. Check your breasts, the woman's breasts, especially for these first time mothers, okay? Because at least if you've delivered, most probably the nipples, what we call the nipples, those tips of the breast, they should be okay. And when you put the baby, you know, the baby should be able to put the whole mouth, you know, cover that nipple and, you know, attach there. So sometimes it can be attachment, how you put your baby and, you know, is not able to suckle because you've not positioned very well. For those first time, these ones you have delivered 5 children of, they know, okay? The nipple is okay, he has many children, she knows. But now the baby is not pulling, it's not suckling because you can be able to see the mouth. It's not suckling. That's a danger sign. The baby could have developed an infection, what we call neonatal sepsis. You remember we talked of neonate, that first 1 month. Now sepsis is an infection which is affecting this what? This baby. Now, the baby can also start to convulse, fitting, you know, shaking those, the hands, the legs, and all those things. So that is a danger sign that either still could be because of that infection, and that infection, you know, can also move and go to the baby's brain and harm the baby. Okay? So when you see the baby has those things, you know, try and say, okay, what should we do? You just have to rush the baby to what?
Hospital.
To the hospital. That is if you already discharged to home. Okay? Now, baby is also, as I said, the color idea should be pink. Baby is okay, not blue. But also they can have a yellow color,
by the way.
what we call jaundice. Okay?
Yeah.
Now, that yellow color can come later.
Jaundice is called
Kamonye.
kamuli.
Kamuli? Kamuli.
It's called kamuli in Uganda.
Yes. Now, that yellow color, you know, it can come after some few days, you know, after delivery. And, you know, the baby is continuing to do the activities. It's breastfeeding, what is not having a temperature. And then still you have to go to hospital. Some hospitals, they are able to test even what is the level of this yellow color in the baby's blood. And then there are certain levels. They say, this is not a very good one. Okay, this one can be treated at home. You know, we tell the mother, you know what the mothers are told. You know, sit in the sun and this yellow color will go away.
Okay.
But even before they test in the hospital, that, oh, this yellow color is so high, this yellowing, what has caused the yellowing is so high. You at home, you can know. The baby has turned yellow, has been breastfeeding very well, breastfeeding maybe last night and what, now in the morning is not breastfeeding. Is striking, getting these temperatures which are high, or is having excessive crying. Okay? So then this could be signs that this yellow may not be, you know, just taken for granted. Although I've said any yellow you see there, you go to the hospital. The doctor will judge and say, okay, this one we shall do it from home. This one, because sometimes they even need to be admitted and given what we call phototherapy. Put them under those lights, which will help to clear that what? That yellow. Okay? Yeah. So the baby can develop all those things. Yeah. So the fevers I've talked about and those yellowing. Yes. So these are some of the things to watch out for in this newborn.
The neonatal.
The neonatal. Exactly. Also, these babies, they can start vomiting, you know, what we call, they vomit all the feeds. It's breastfeeding, but everything is coming out. Everything is coming out. So this may not be a very good sign, okay? Because some babies can be born with some complications, even at birth, whereby the intestine has some blockage. Okay, so what the baby is feeding is not going in very well. So instead, it is just what? coming out. Okay. But also what I had forgotten is that at birth, when the baby is born, we expect at least within 24 hours, the baby should pass poo. Yes, should pass. And then still within 24 hours or even up to 48, that is up to 2 days, should be able to pee, to urinate. Okay. Now, if you have the baby has not done any of those things, you are now 2 days, 3 days, it should cause a concern. Shouldn't say, maybe this baby has not eaten when I breastfeed. No, it should cause concern because some of them can be born with those complications, which happened when they were still in the womb. When the kidneys, where our urine starts from, they are not functioning very well. Or they may be functioning, but somewhere where the urine goes down, there's a blockage, an obstruction, which idea sometimes we can see on a scan when a woman is still pregnant, but sometimes we can miss it to see it. So those complications, and it's not passing poo, then problems also could be there. So all these things have to be looked out.
Okay, thank you so much, Doctor. So nze Justin ninako kibuuzo kitini Doctor about our babies kuba nakirabako ku my first baby kino ekintu ky'okuziira waliwo sometimes omwana kuba nze twali tuvuddewo and it was somehow late in the night naye neetandika okulaba nga asika omukka saakitegeera bulungi. When I took her to the hospital, of course they gave us those drops. Yeah. But how is it kijja kitya from the hospital wemuzadde nti tebamugira bulungi kiba kiva ku ki?
Yes, so yes, I hear a lot, when the baby is there, you say, maybe tebamujjamu, tebamusikamu bulungi. Yes, that it can happen, but we try to suction when the baby is born. But of course, some little fluids and some of those things, a little of them, could remain. They went down, but as the baby moves on, they easily adapt and those things come out. However, that one should not be taken for granted because, as I said, the baby's lungs, maybe they didn't develop very well. Okay? And especially for these ones who are born when they have not finished all these, 9 months, for us what we say 40 weeks, okay? Or from 37. They could have some complications which are not seen here, but they are inside. So when a baby gets such an issue, we shouldn't just take it for granted. Take the baby to the hospital, then the doctor will assess. Can even put some small those machines, try to check, and then say, okay, maybe this one is a minor thing. Do a BCD.
Okay.
Yes.
Banai abalabi baffe ndowooza we've learned a lot. Thank you so much, Doctor.
Okay.
Thank you for this. For sure, we've learned a lot. Nga Lilian wagambye agenda ku antenatal on 6 months. Olumu omuntu abeera eyo n'agenda even at 7 okufuna ekipande. So let us mind a lot about our lives. Banayi mulimu okufa. So let us take care of ourselves, our babies, so that we can, tuzaale bulungi ate tunyumirwe bulungi obulamu. Thank you so much for viewing us. Thank you so much for liking, to Sima. And to our sponsors, Mercy Schools, Marina, we at Marina, Banayi tubebaza, Villas. Bane, we really, really appreciate sponsor baffe abekyama. Those, yes. Bane, we really, really thank you so much. Thank you for loving us. For those who share and comment, for those who like, we salute you. Thank you so much. Have a good day.